of what they're listening to. My name is John Baumgartner. I'm the Behavioral Health Manager of Broward House's Intensive Day Treatment. Been working in the field of addiction for several years and have had the honor of serving clients as a therapist here at Broward House in our Positive Healing program prior to joining the treatment team. So today, there's a lot to discuss, and I'll try to get through as much as I can since this is only a 20-minute presentation. But today I'm going to be talking about trauma-informed care. This practice has become absolutely essential in working with our clients, most of whom are covered by Ryan White. And hopefully you will implement this system into your practice as well. You know, it's really interesting how each and every day our clients teach me more and more about the importance of trauma-informed care and the need to recognize this humane system based on compassionate understanding. So the learning objectives, hopefully, if I've done my job, you will learn about, you'll learn to understand what trauma is, the health implications associated with it, the really all-encompassing system of trauma-informed care, practical applications, and hopefully an understanding of why this is so very important for the clientele that we serve. So when we talk about trauma, we talk about, we're really speaking about intense and overwhelming experience of loss or harm to a person's well-being. It can be both physical, it can be emotional. And these experiences actually can overwhelm a person's capacity to cope. Not always, but sometimes. This could be a single episode or a series of events that have adverse effects on a person's functioning. So potential instigators of trauma, it can just be caused by a lot of different stressors. As you see, abuse, loss, chronic stressors, you know, there are tons of things we can add to these lists, and note that these can be, you know, I mean, we're not just choosing one. Many of our clients experience many different losses, many different traumatic events. And like I said, it can happen over a period of time, like a repeated sexual assault as a child, or even as an adult, a single, you know, episode like a natural disaster. And like I said, this slide actually lists some, but certainly not all possible traumatic events. And I think you'll agree that most, if not all of our clients fall into at least one or more of these categories. It can be caused by events that the individual doesn't even remember, such as events in early childhood. It can be caused by events that really didn't happen to the person, but to a group which the person identifies with, such as slavery or the Holocaust. And then we have chronic stressors that can accumulate to cause trauma, like living with HIV or simply being diagnosed with HIV. HIV stigma can cause trauma in the form of discrimination, not only by systems, but actually by family and coworkers. It can also be based on someone's real or perceived status, like somebody just assumes that somebody, because of the way they look, that they are possibly HIV positive. So trauma can occur from hearing about, watching, or interacting with others who've had traumatic experiences. So I ask that you really carefully consider the enormous amount of possible stressors that can occur unintentionally when you think about your organization and those that represent your organization, not due to anything malicious, but due to a lack of understanding. So the next slide is going to talk about, think about the people we serve. Like I mentioned, a great many, if not all of our clients that we work with, at least from Ryan White, have have suffered some type of trauma throughout their lives or possibly continue to suffer trauma. Childhood sexual and physical abuse are far more common in those living with HIV, as well as intimate partner violence for adults with HIV. Trauma is also really widespread in the lives of those living with HIV. And this very fact really influences their health, their well-being, particularly in linkage to care. Some are, due to stigma, are just afraid to get treated. They're afraid to go to a clinic. They're afraid to go to anything that's connected with HIV for fear of being found out. So the other thing is viral suppression and adherence to medication is a big issue because of those issues. Not only that, but securing the funds or securing a way in which that they can get their HIV medications. So we're going to move on to potential results of trauma. So trauma, it can have long and short-term effects. It can affect an individual's coping responses or the ability to engage in relationships due to fear. Trauma can impact a person's behaviors in ways that are hard for others to really understand. So if you're thinking about like a person that's sitting in a waiting room, may become angry or agitated, when told to wait if a provider is running late for an appointment, or a person who gets angry when someone touches them or on their arm or their shoulder to get their attention, may have been physically assaulted in the past and may have a startled response to being touched without warning. Behavior linked to trauma is most often a learned coping skill to protect themselves against future harm. So these people are acting on cortisol and adrenaline in their brain systems. Trauma can also affect an individual's physiological responses and health, psychological well-being, social relationships, spiritual beliefs. Can cause mental health and substance abuse issues, including depression, anxiety, chronic pain, suicidal ideation. And trauma is associated with much greater numbers of opportunistic infections or AIDS-related deaths. So again, when we're talking about our clients, we're talking about the possibility of each and every one of them experiencing some of that. So trauma can also obviously occur at all different levels of a person's life. I'm just going to read a quote. Structural violence has been defined by Galtung in 1969 as a preventable harm or damage where there is no actor committing the violence or where it is not meaningful to search for the actors. Such violence emerges from the unequal distribution of power and resources, or in other words, is said to be built into the structure of society. And I think that's a good example of what our clients face. Structural violence is a lot harder to identify, and it can be found in state and federal bureaucracies, many health institutions, social environments, and social and health policies that could create conditions that contribute to disproportionate health outcomes and death among HIV people. Structural violence can encompass things in these circles like institutional racism, homophobia, transphobia, and other stigmatizing social norms. Can occur as criminalization of sex worth, substance abuse, HIV status, discrimination in housing, work, education, or healthcare. It can also create barriers for people of color in the LGBTQ+ community that are HIV and prevent them from accessing, the adequate healthcare. And so some of these populations, we can't address all of these issues, but it's important to acknowledge and understand how structural violence impacts people's lives, period. So we're going to move on to talk about trauma-informed care. And trauma-informed care is just a set of practices that promote a culture of safety, empowerment, and healing. The system recognizes and implements policies and practices for responding appropriately to actually reduce and resist re-traumatization, allows for safe, compassionate, understanding space that embraces the client, avoiding any form of shame or judgment. And is it easy? It is certainly not, but this is highly necessary in order that we may address the client's overall health, mind, body, and spirit. So according to SAMHSA, there's 6 principles of trauma-informed care. The first step is actually, as we go through these principles, I want you to consider it's highly probable that every client that interacts within our agencies have experienced some degree of trauma in their lives. So the first principle is safety. And when I talk about safety, you're talking about both the physical and psychological safety throughout the organization, not only among the clients, but the staff as well. Clients coming through our doors for whatever reason may feel vulnerable and nervous. Maybe they're newly diagnosed, maybe it's their first visit. In any event, they really deserve to feel welcome, safe, and comfortable. So we're talking about welcoming environments that feel comfortable, safe, and respectful, greeting people when they come in, treating them as human beings. These are conducive to healing, while non-welcoming environments feel really uncomfortable, disrespectful, unsafe. I mean, think about yourself when you go into situations when you're first walking into any type of office for the first time. I don't know about you, but I'm, a little anxious because I don't know the process. I can only imagine if somebody has dealt with trauma, particularly structural trauma. I can only imagine what their anxiety level would be like. So think about your facilities. What would make you feel safe when entering a space for the first time? Be mindful of any negative signage or institutional setups, stark settings, and greet clients in a warm and welcoming manner. So the trauma-informed principles start, as soon as the client arrives at your property. It could be a maintenance worker, it could be, the receptionist, it could be some of the peer advocates, it could be the housekeeping crew, it could be the cooks, it could be, the COO, it could be anybody. So we're talking about having this mindfulness throughout the whole organization. So the next principle talks about trustworthiness and transparency. We just want to give them full and accurate information. I mean, take the time to explain the things to them. And if you don't have the answer, then let them know that you will get the answer, and then follow through with that. Take time to explain whatever process they're going through. Just telling them what to be expected can be really important. Be authentic. I mean, respond in a truthful, authentic manner. Clients that have experienced trauma generally have fine-tuned radar, and they can detect your emotional state. So if you're not sincere, they're going to know it. Talk about the importance of confidentiality and protection of their information. The other part is just that all the operations and decisions within the organization are conducted with transparency, constantly building trust. The next principle talks about peer support. Peer support, it's not just a service model. It's really about developing an authentic mutual relationships and not applying like a cookie cutter approach to everybody. Each and every person that walks through our doors has a completely unique experience. I kind of look at it as as like research. I mean, I want to know what's happening in these people's lives. I want to know what it is that makes them tick. I want to know what it is that they've been through, what has happened to them. Peer supporters don't use, are much less clinical, so they don't use the clinical language or focus on what's wrong with people. It's just sharing experiences. So, the peers can share a common experience and certainly develop trust and the alliance. Coming from the therapeutic point of view, the therapeutic alliance, if there's nothing else I do well as a clinician, it's creating the therapeutic alliance. And that is making every person that walks in my office or in this place feel welcome. That is, I'm paying complete attention to them. I'm restating things they've said to get clarification. I'm not distracted doing other things. I'm really paying attention to what it is that they are telling me. The other part is I want to consider what their goals are. Their goals are generally very different from what my goals are for them. So I want to understand what it is that's truly going to help these people, and by creating that therapeutic alliance, clients feel safe, they feel trusted, or they feel a sense of trust. So we're going to move on to collaboration and mutuality. So it's just maximizing collaboration and sharing of power with clients. It just levels the power differentiation between the client and a staff member. Collaboration, is recognition that healing helps in relationships, and that like meaningful sharing of power and decision making again makes whether it's staff or a client feel like they're part of the process. You don't have to be a therapist to be therapeutic. You don't have to be a therapist to be welcoming and warm. Think about what it is that you would like to, how you would like to be treated in any situation that you walk into. So then we talk about some empowerment, voice and choice. We want them to know that they do have their own voice, that we care, that they have choices. They always have choices. This principle really reflects a positive and creative attitude rather than a specific technique. Find ways to utilize and showcase the strengths of the staff and people you serve as well. Identify ways to offer choice around services or activities. Think outside of the box. Again, getting away from the institutional type model is accepting the staff and the clients as just individuals and working with them in the best way that's going to be, profitable for them. Consider strategies like to empower others by making them an integral part of the organization, outreach, engagement of others in services, social media campaigns, and peer support work. So, then we have to take into account the principle of the cultural, historical, and gender issues. And the action of this principle just allows for actively moving past cultural stereotypes and biases, offering gender-responsive services, leveling the healing value of traditional cultural connections. So, again, trying to get to understand where people are coming from. What is there? I don't know anything about, certain heritage. Tell me about that a little bit. Be inquisitive. Ask about them. What I have found in just life and experience is people like to talk about themselves. So if you can get them started, they'll tell you as much as you want to know. So the other part, historical issues, particularly around HIV, would be the LGBTQ plus populations throughout time, the toll of the AIDS epidemic, and the impact of generations of racism and poverty. So who should practice it? Everybody should practice it. The simple answer is that everyone from receptionist to CEO, maintenance workers to therapists, every single person within the organization. So all in all, we can create an authentic system that seeks to understand the whole person who listens while developing, a real partnership that relies on an individual approach to a really complex experience. Again, we all like to set up systems and ways of doing things and processes and all of that. But what I've come to find out that those processes are good while they work, and that they also need to be tweaked as we gain more information about what is more useful, what is more helpful. And that, comes from, staff that cares. It comes from getting information from clients. It comes from talking and engaging with people to see, hey, maybe this isn't going to work, but maybe this would be a good idea. Use everybody in your organization plus your clients to make a better system. So, things to remember. The underlying question should never be what's wrong with you. It should always be what happened to you. Treat your clients with the utmost respect as human beings. What are called mental and substance use conditions or symptoms, these may be just adaptations to traumatic events. These are coping skills that people have learned in order to deal with whatever stressors they come up with in life. Obviously, some of these things may work for them for a period of time, but it comes to a point where they stop working for the client. Behaviors have meaning and purpose, so people don't just act out. They don't act out badly or poorly or angrily. People don't just do that because they want to do it. There's something behind the reason, or there's a reason behind everybody's behavior, and that healing does happen. Is it difficult? Yeah, it's difficult. It takes time, and it takes a lot of patience. So I am going to share this little Brene Brown's little video. I'm sorry I can't blow it up, but you'll hear the video regarding empathy. Uh-oh. We're not hearing that, are we?
John, it may be the way you have things shared. If you want to give me 1 sec,
Yeah.
I can pull up the video.
There we go. Uh-oh.
Scholar who studies professions, perceptive
Okay.
John, I do have the video pulled up. If you want, I can share it.
Okay, go ahead.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, woo, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
And John,
We
you should
back?
give it a, yep, go back to Sharon.
Okay, thank you. Sorry about that hiccup there. We had some technical difficulties getting set up here. So anyway, I hope you enjoyed that little blurb on empathy. Oops. So the practical applications of, I'm going to run through these quickly because we're running out of time, but practical applications of trauma-informed care are building trust and creating a safe and welcoming space for the client. Like I said, think of yourself when you walk into a space. I consider, smells, seating, I have a design background, so I'm looking at wall colors and lighting and all that kind of stuff. I can tell you when I walk into an institutional looking place, and I can tell you when I walk into a calm, welcoming space. Actively listening to what your clients have to say and restate what they've said to gain understanding, to make sure that you understand them. This shows that you're paying attention. It shows that you're listening. Form an alliance with the client. I mean, that's going to be most beneficial for you to ever get things done with the client, to get them to be anxious about returning, to get them engaged in their treatment. Always be mindful of your posturing. Like, when you're with clients, don't stand over them. Give them their personal space. Don't ever touch a client, that's on high alert. If you do want to pat their shoulder or something, of course, ask for permission. And it just depends. You'll get to know as you're working with clients over time, you'll actually see them begin to relax. That's one of the most interesting things I find when I'm meeting a new client for treatment is to watch their shoulders relax, watch them take a little deep breath, I can actually see them start to relax and to know that I'm there to see if I can help them. Utilize soft and measured tones. Don't ever slow your voice down. Don't use, angry tones. Watch your facial expressions. Collaborate with the client. We're not just there telling them what they have to do and what they need to do. Collaborate with the client. Ask them what they need. Do they need the assistance to fill out a form? Do they need help with calling an organization? Work with the client to find out what it is that they need. The client always has the power, and we certainly encourage autonomy. Clients always have choices. The choice is they can stay here and work with us and know that we're going to do the very best for them, or they can choose not to. Utilize strength-based resiliency. All of our clients, if nothing else, they all are very resilient. They have been through the ringer, sometimes, some of them more than others, and understand the client's goals and implement change through their lens, not through our lens. The fact that somebody shows up to an appointment is a real, that could be, one of their greatest achievements for the day. And understanding our clients sometimes are riding buses, they're riding bikes, they may be late to appointments, they're coming in all sweaty and hot. They may be just a little bit perturbed at the moment, and understand that. So what do we want to do? We want to help them calm down. We don't want to exacerbate that. So the final thought is just always consider what happened to you versus what's wrong with you. We can't rewrite the histories of the clients, but, at the very least, we might help them, help them build more resiliency and help them function better physically, emotionally, and spiritually. And that's it for me today. Thank you, guys.
John, if you want, we can take some questions.
Happy to.
So you guys are welcome to unmute yourselves or type in the chat box. Okay, we're not seeing any questions, so I think that we can end here for the day. Thank you so much for this really informative presentation, John.
You are very welcome. Thank you guys for the opportunity.
You're welcome. We're happy to be able to share all this great information with everyone so we can keep improving the quality of the care that we provide in our system. So we want to wish you guys all a great day, and please join us tomorrow for a HIV and poetry presentation that should be really exciting and different. So have a good rest of your day.
Thank you.